Hello all, I am Dr. Suresh Sepuri, consultant surgical gastroenterologist and laparoscopic surgeon at Pace Hospital, High Tech City. Today we shall talk about inguinal hernia or groin hernia. So of late, inguinal hernia is one of the most common surgical problem we face day in day out. So I have found certain set of questions or certain set of queries which are there in patients who underwent surgery or who might undergo surgery for inguinal hernia. So this is one of the most commonly asked question by my patients. So if the hernia was large enough and it was a complete hernia, I had to dissect too much in the scrotum. The chance of having seroma as a complication is higher when compared to smaller hernias. In that case, I might advise for scrotal support in those set of patients for at least 2 to 3 weeks post surgery. Seroma is nothing but a collection of fluid within that potential space in the scrotum. So, by providing external compression with the help of scrotal support, I may decrease the recurrence or prevalence of these complications after surgery. The obvious swelling which was seen before surgery immediately disappears after surgery, but some amount of tissue edema might be there post surgery. This should not be confused with inguinal hernia swelling. So, whenever you see this swelling persistent even after 1 to 2 weeks after surgery, which is gradually increasing in size, you need to consult your surgeon once again. So most of the times it turns out to be seroma and not recurrence of the hernia. Seroma is nothing but a collection of fluid, as I told you, within that potential space. As such, there is no medical line of management of inguinal hernia. So inguinal hernia is basically a defect, it's a mechanical defect within the wall of the abdominal wall, especially in the groin. If it is there in the groin region, it is called as inguinal hernia. So this mechanical defect has to be closed with surgery or some kind of process. Most of the times it is the mesh we used to close this defect. So basically, when this inguinal hernia surgery is done through laparoscopy, we advise the patient, we discharge the patient on the same day or the next day. So, and we even advise the patient to resume their daily activities like using a loo, sitting and having food, talking to their, sitting comfortably in a chair, and all those things the day of surgery itself, given that he is comfortable enough. So, as soon as the patient gets discharged, he is good to do all the routine activities like self activities like watching a TV, sitting in a sofa, traveling for a shorter distance, walking on a flat surfaces as soon as possible, given that he is comfortable doing so. When the surgery is done laparoscopically, he can start driving for a shorter distances in a couple of days post surgery, or he can travel for longer distances given that he is comfortable 1 to 2 weeks after surgery. So going to a gym and lifting heavy weights, so we generally advise the patients after 3 weeks of surgery. So whenever he feels some amount of discomfort in the operated area, it is advised to postpone that activity for at least 1 to 2 weeks. If the patient had to undergo surgery through an open access, this duration might change a little bit. So due to the pain and the wound itself can cause some amount of discomfort to the patient. So it is advised for these kind of patients to start resuming to strenuous activities like driving, lifting heavy weights 3 months post surgery. So some amount of discomfort might be there in these set of patients, but the pain that is a traditional type of pain usually seen with open hernias is not seen with laparoscopic hernias, but some amount of tugging sensation or something pulling or dragging might be there. It is commonly seen in the patients who undergo surgery for inguinal hernia. Yes, there are situations where the contents which are protruded from the abdominal cavity into the groin through these defects cuts off, have their blood supply cut off or gets obstructed or strangulated, if neglected, can lead to a surgical emergency.